Hello, I am Dr. Kittipong Siribunpipat, an orthopedic doctor at Chularat 11 Hospital, specializing in hip and knee replacement surgery. The indications for hip replacement surgery can be divided into two main groups. The first group consists of those with underlying diseases. The group with inflammatory joint diseases, the type of arthritis that we often hear about and are familiar with, includes various types of rheumatism. In this group, there are actually quite a lot of diseases in this group. The second group that we often encounter is the group with avascular necrosis of the hip. The causes of this can include a history of previous trauma, long-term use of steroids, or other types of medications such as antiviral drugs. Another major group, the second group, consists of patients who have had accidents and suffered a fracture of the femoral neck or hip. In this group of patients, we mainly consider the patient's age. If the patient is young and we can stabilize the bone, we will try to fix the bone first. But if the patient is elderly and we think that fixing the bone is unlikely to result in proper healing, then it is better to perform a hip replacement surgery. Regarding hip treatment, I should mention that the hip joint is located at the front. So when patients have symptoms, the pain will be at the front, not the back. Most patients tend to misunderstand this. They think the hip joint is at the back, so when they feel hip pain, they complain about pain in the back. But actually, the hip joint is at the front. Therefore, when there is pain, it will be felt at the groin area or the front of the thigh. In some people, the pain can even radiate down to the knee. For all of these initial treatments, except in cases of fractures, if it's caused by other conditions, we will first treat according to the symptoms. For example, prescribing anti-inflammatory medication, reducing activity, or doing physical therapy. In patients who do not improve with these treatments, surgery may be considered, specifically hip replacement surgery. The surgical techniques used will depend on the specialist. As for whether hip arthroscopy can be performed, the answer is no. It requires open surgery because we need to remove the femoral head and replace it with an artificial one, inserted in its place. Regarding recovery time after hip replacement surgery, in most cases, if the patient has been suffering from the condition for a long time, the surgery will greatly improve their comfort because when we move the hip joint, the most noticeable difference is that movement will no longer feel stiff or restricted, and there will be no more pain. After the surgery, patients can stand up and walk with the help of a walker within 3 to 4 days.